COPD stands for chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease is a disease where patients have difficulty getting air out of their lungs. To understand this, you have to understand how the lungs work in the first place. So when you want to breathe, your diaphragms move down, your chest cavity expands, and just like a bellows, that causes you to suck air into your lungs. When you exhale, your diaphragms move up and your chest cavity, your rib cage, relaxes and goes into a more neutral position, resting position. And that squeezes the lungs just like a bellows will squeeze the air sac and push air out. The problem in patients with chronic obstructive pulmonary disease is that their airways have now become too compliant. They've lost their elasticity. When you think about the concept of elasticity, take a look at your own skin. When skin is young and healthy, you pull up on the skin, it snaps back into its original position. Just like a rubber band. When you expand a rubber band or pull a rubber band apart and you let it go, it comes right back into its original position. The same idea happens within your lung airways. So your lung airways have a nice shape to them, usually circular in a tube, and they're able to maintain that position throughout the respiratory cycle, meaning that as the lung expands around it or collapses around it, it maintains its shape. However, with chronic exposure to cigarette smoke or other lung irritants like air pollution, the elasticity of the tube itself becomes diminished. And as a result, it can compress when you're exhaling and the lung is compressing around the airway, it can squeeze the airway tight. Or when you are inhaling, it can pull the airway open. The problem occurs obviously when you are exhaling and you're squeezing the airways down, then whatever air is in the air sac here can get trapped. So patients with COPD, chronic obstructive pulmonary disease, tend to take a longer time to exhale. If you are breathing quickly as a result of walking or exercising, you are not providing enough time for the air to get out of the lungs completely because of this narrowing. So when you take your second breath, you have not completely exhaled, so you still have air stuck inside these air sacs. So your next breath makes your lung a little bit bigger. And again, the same thing happens. When you exhale, you're not able to get all of the air out before you have to take your next breath because you are trying to breathe faster to provide more oxygen to your muscles and to try to get carbon dioxide out of your lungs. Eventually, with all this air trapping, your rib cage, thoracic cavity starts to expand dramatically. Your diaphragms come down significantly to the point that you can't open your lungs anymore. Just like when you open a bellows, it can only open so far. And at that point in time, you have so much air trapped in your lungs that you are no longer able to bring air in. So that is the reason why patients become very short of breath and have that sensation that they can't get air in.